Mass violence is a public health and public safety problem. There are, unfortunately, major ripple effects of mass violence. As a result of that, nobody really feels safe, and no place feels safe to us because of who we are, what we believe, who we worship, who we love, or what we look like.
Communities are affected by mass violence in multiple ways. First of all, they're affected in terms of the direct impact on the health of residents. But mass violence incidents also affect social fabric and economic function of a community, put communities in a bit of a vicious cycle where you have negative impacts on mental health, negative impacts on social economic function, which then also affects mental health adversely.
The National Mass Violence Center was established in 2017 with a cooperative agreement grant from the Office for Victims of Crime in the U.S. Department of Justice. Our mission is to help the Office for Victims of Crime improve community preparedness and the nation's capacity to serve victims recovering from mass violence. When our center started out, we really focused largely on sexual violence victims. We then moved on to studies of other types of violent crime, and then did a couple of studies of survivors of mass violence incidents and terrorist attacks. One was of the Pan Am 103 bombing over Lockerbie, and when after 9/11, the effects on the mental health of people in the New York City area. We then did some work here with Mother Emanuel after the mass shooting there, and actually assisted the community and the church in terms of the response to that horrific event.
The response to mass violence crimes, it is not a one-man show or a one organization band. It requires partnerships. It requires people working together for a common good. It's not a competition to see who can do more. It really is necessary to have as many organizations and individuals who can respond as possible.
Shortly after we were notified about the Mother Emanuel shooting in 2015, the National Crime Victims Center were part of the immediate response that evening and the days after, and were integral during the recovery phase for the family members, for survivors, and for the church members in the larger community. And because we were connected with our local and state organizations and agencies, we were able to collaborate with a number of different community partners to coordinate behavioral mental health services, victim services, and resiliency strategies for those impacted.
October 27, 2018, when a gunman entered one of our local synagogues while they were worshiping, a resiliency center was set up with the recognition that the community was greatly impacted, that it was the direct victims, but also the larger community who felt targeted by this act. So one of the areas that takes a lot of work for a resiliency center and where you feel really lost is around how to support the community through legal proceedings. Our organization really leaned on the NMVC court guide. We learned how to partner really effectively with our U.S. Attorney's Office through that guide, and then through the trial how to support the victims and how to support the broader community. For me, when I started this work, there was no way to learn best practices. And so I'm really proud that I was part of the first NMVC forum for the directors of resiliency centers. And that was really important to me. One, that I could learn from other people, and two, that anyone else who was put into the position I was put in of trying to be a community member who also is leading the healing path, that we could support each other, that no one would feel like they had to do that alone, and to really build a network of leaders in this area.
As a survivor and a responder, I believe that the impact NMVRC has had on all of us is that it provides hope to the hopeless. Through its informed evidence-based response, it gives us all a framework with which to place the impossible circumstances of the tragedy that we have suddenly found ourselves immersed in. Having that gives me hope that I am not alone, and that others have gone through the uncharted territory and have left their experiences as road signs for me to follow. And though each of our journeys are different, having hope, I am able to face that which lies ahead.
The efforts that the National Mass Violence Victimization Resource Center provides are critical to addressing the comprehensive needs of victims and their families who sadly have to deal with the aftermath. I'm committed to continue to work together with all of those who understand that these tragedies need not happen. And together we can enact compassionate policies and raise the awareness of these critical issues. We have to.
Well, one thing I would like to see in the future is obviously that there would be no mass violence anymore, but I think that's very unlikely to happen in the near future. So what I would like to see the future be like would be that the National Mass Violence Center would have the resources that it needs to continue providing information, resources, and services to victims of mass violence, that every community would be prepared for mass violence and would not fall into "it can't happen here" when we know it does. And finally, I would like to see that every victim of mass violence, past and present, would have access to the services that they need and so richly deserve.